Okay, today this is going to be much more practical what we're seeing at the SLAT level. We'll talk a little bit about the science, but I'll acknowledge a whole lot, cooperation from a whole lot of people who are a whole lot smarter than I am to talk about more of the sophisticated parts of this. But we're going to talk about Senecavirus A. I made the note here, Senecavirus A equals Seneca Valley virus. The International Taxonomy Society has gone back through and renamed some of these, and so you'll see me probably use Senecavirus more, but we're talking about Seneca Valley virus, all the same thing. They're just trying to get a more scientific nomenclature moving forward for some of these viruses that have picked up these other names. So, acknowledgements. I'm going to start out with this because what you're all going to see today is certainly not all of my doing it all. This is all a collaboration with a big group here at Iowa State University. We've got virologists, pathologists, postdocs, students, and then a lot of this stuff couldn't be done, and really appreciated Paul's message this morning. I kind of, as this thing was first going, and a conversation I had with Paul, this is kind of our shoe heart, right, or a test, really. So, I mean, we're fortunate that thing has been established. That group's been fantastic to work with to help us try to get samples collected and get answers very, very quickly. One of the things as I transfer from industry to academia is understanding some of the things that you have to go through in order to get money. So Paul's been very good about funding some of these studies that you'll see today where we could get answers very, very quickly. So very, very appreciative of that. Okay, a little bit of the science part. So Senecavirus A, it's a non-enveloped, single-stranded RNA virus in the same family as Picornaviridae, and you heard him mention this morning. It's very clinically indistinguishable from foot and mouth disease. So you're going to see what I wanted to do in here today too is take lots of pictures, be able to put a lot of those in there, hoping to educate as many people as we can to be on the lookout for these sorts of things, because some of them, quite frankly and honestly, look like things you would probably normally see, even without vesicular disease. So it's really to try to create awareness. As Paul mentioned this morning, it's been in the U.S. Probably since the mid to late 80s, so it's not really a foreign animal disease because it's already been established to here in the United States. You know, it's been very sporadic. It was 1 or 2 cases a year, and we knew that because Plum Island had all these vesicular disease investigations that they went through. And it was really called Idiopathic Vesicular Disease until more recently a PCR for Senecavirus A has been developed and then used and then found in association with that. And in the last 5 years, prior to these outbreaks, we found it in a few other states, as Paul mentioned this morning, so I won't spend a lot of time about that. So that's the question, right? And Paul talked about that, is it really causing idiopathic vesicular disease or not? And as he mentioned, and they're putting out funding for research proposals to try to fulfill all of Koch's postulates to say that, hey, we can find the virus in the lesions, and you'll see in some of these cases, we're not, especially in young pigs, we don't see lesions, but then can we reproduce the disease? And really Paul covered quite a bit of that, so I won't spend a lot of time about that. So let's talk about where, from an Iowa State University standpoint, where we started to first see increased incidence of this disease. It really started in and around July 15th to July 21st with 2 calls about exhibition pigs. And the reports were, hey, I got pigs that were shipped to the fair and they were fine, and then now they're acutely lame, or I got pigs ready to go to the fair, they got to go tomorrow. And the producer called me this morning and he's like, I got these 4 pigs, they're all lame and they've got all this redness around their coronary bands. So I quickly passed that along to the pathologist, and one of them's like, oh yeah, I heard something about that last week in a different place. So we started coordinating, talked to the veterinarian who said, boy, if you haven't seen these pigs, you need to. So they went out there, saw vesicular and coronary band lesions, contacted the state and federal veterinarians. Foreign animal disease investigation was initiated. And interestingly enough, as Paul talked about this morning about, well, they've tried to put Seneca in really normal pigs, have been acclimated, and they can't reproduce the disease. So it's this whole cofactor question. Well, both these cases that occurred after a stressful event. They'd picked up, transported, which in big pigs, that can be extremely stressful. So Paul had these slides up this morning. These are from some of the initial ones. Probably can't appreciate it real well here. There's some redness here. That's what these arrows are pointing to. No really lesions on the coronary band. There's a little bit of a deep nail bed hemorrhage. I'll show you some better pictures later. And this looked like it was probably more of an already erupted vesicle rather than a big, round, smooth, clear vesicle on the snout. So foreign animal disease investigations, samples were split. At Iowa State, we were able to test for, all the non-labs are able to test for foot and mouth disease. And we had a gel-based PCR that Dr. Yoon had in his lab. So we tested them for FMD, Seneca Valley virus. So FMD all negative, Seneca Valley virus positive. And we were able to isolate from one of the hoof scrapes, actually able to isolate the virus. The Plum Island samples went. Obviously, they tested for Seneca Valley virus, and then the 4 other vesicular diseases that are foreign animal diseases, and they were all tested negative. But the Plum Island PCR also picked them all up as Seneca Valley virus A as well. Second case, really, more of the same. We could FMD negative, Seneca Valley virus positive, and from the vesicular fluid, we were able to isolate virus. So, not shortly thereafter, as we're dealing with these couple of exhibition cases, we got a call on a 1,200 head finishing barn with a report of acute lameness and vesicular lesions on the snout and feet. And it was kind of like the initial reported prevalence were like they're market weight animals. We took a cutout on July 10th, and July 15th, the producer came in that morning, and that morning he had like 20 to 30%, 4 or 5 pigs in every pen that were acutely lame. So same deal, FAD investigation was initiated, negative for all the vesicular diseases, positive for Seneca Valley virus. Interestingly enough, we had the opportunity to take a team up there and collect some additional samples, which I'll show you some of those results here in a second. But in the course of looking at what was going on in that barn, they'd already taken out a couple of loads, was the fact that these pigs had a pretty active case of coughing. We did some oral fluid surveillance, so we tested them for Seneca Valley virus. We also tested them for PRRS, circovirus, influenza, and mycoplasma. And the PRRS and influenza were negative. The circovirus was positive, but a very high CT, so didn't really think that was all that clinically relevant. But 2 out of the 4 ropes tested positive CT values in the upper 20s for mycoplasma. So they certainly were concurrently infected with mycoplasma, and wondered if that didn't contribute to the severeness of the case that we saw there. As I said, the barn was topped on July 10th. A couple of things in the epidemiological investigation that we noted what were things of concern or risk. One was that they had taken a dirty market truck in, and that had been to a packing plant the day before. The driver actually put his boots and coveralls on and then actually got into the truck but walked into the barn as well. So that was a risk factor. And then the other thing was the producer used a commercial loading crew to come in and help load these pigs out. So kind of as development over the first 10 to 14 days of an infection, what was really impressive was just the high number of pigs. So over the next 2 weeks, it appeared that 80 to 90% of these pigs had some sort of lesions, whether they were vesicular lesions on the snout, on the coronary bands, or lameness. The other thing which was interesting is you walk in and you talk about that many pigs affected, you're like, wow, they must have been thin, losing weight. And he's like, no, they're really in pretty good body condition, but they got to crawl to the feeder. I got all these pigs that are crawling to the feeder, but they can get feed and water. So clinically, other than the fact that they can't stand on their feet, they look pretty healthy. So we did about 14 days to into the break. We took some samples from 3 clinically affected pigs. We looked at vesicular fluid from 3 of them that we found, some swabs of older lesions that were resolving. We did some skin scrapings on some older lesions in the nose. We pulled some blood, and then we also tested oral fluid. So you can see anything to do with samples directly from the lesions had fairly low low CTs. Lots of virus appeared to be in those type of lesions. The serum looked like there was a viremia, but the CTs were much higher, and then the same for just swabbing the lesion without the resolving lesion without breaking the skin. The interesting thing was the oral fluids were fairly low too, and that was potential discussion about, well, could we use that as a screening test, because we understand that the antibody is going to take a little while to show up. But the oral fluids were actually fairly impressive too, in that they were in this upper teens to low 20s region, so lots of virus there as well. All right, so this is the video. This is 2 weeks after that, so 4 weeks into the break, about 30 days later. Most of the lesions, certainly the vesicular lesions, especially on the snout, were resolved. And the pigs were starting to be able to walk around again, but as you can see, one of the things that we classically talk about pigs with lameness is they're walking on eggshells. They're propriocepting and stepping very lightly, and you can kind of tell on some of these pigs they're pretty, they're painful on one or more limbs. So, but you can see the pigs are in really good body condition, right? So they're still getting to the feed and water, but you can certainly see in this case that that pig right there to the left. You can see how carefully and gingerly they're putting that back left leg. Not wanting to bear a lot of weight on that. So that's kind of what we saw 4 weeks into it. We walked around and looked at some other lesions. This was one, and like I say, you're looking at about 30 days in, so the vesicles are kind of gone. But so what we did, we're looking for lesions, and this was really consistent, which I hadn't really seen a lot of report of in the past. Here you've got kind of an open ulceration, but you had all these deep nail bed hemorrhages. It's like somebody hit them, like you hit your finger with a hammer, and you get a black and blue, lesion there, except these were bright red. And actually in this barn, that was probably one of the more common lesions that we saw. Once again, understanding that they're about 4 weeks into this, that was a very common lesion that we saw in that finisher. And then here's the hygromas from the animals crawling on their knees to get into the feed and water. Once again, I don't know that you'd see that acutely. This is probably more due to the chronic part of this condition, or by the time we got in to take these pictures. Here's a resolving, healing of vesicular lesions, and I'll tell you, they resolve very quickly. So it can be a matter of days. They can go from that nice, big, clear vesicle to that vesicle rupturing and healing very, very quickly. So there's one, a little bit more of a bullous appearance there on the snout. So you saw the CTs from the oral fluids about 2 weeks in. We're in that 18 to 22, so we were about 4 weeks after that July 15th when they first noticed clinical signs. We pulled oral fluids again, and you can see pretty consistent. Now they've kind of moved to this upper 20 range. We have not and did not go back and do any virus isolation on that, because as you'll see here in a moment with some of the data, that's the question about, well, do they got to be negative to no longer be shedding or not? Because it looks like we have the potential for the oral fluids to be, fairly significant cycle time values for quite a time period after initiation of the infection. We took 5 pigs in as well. I had the pathologist kind of tear them apart, tested a whole bunch of the different tissues. Probably most importantly is they saw very impressive lesions in any of the claw or the vesicular lesions, but looking at any of the other tissues, they did not appreciate any gross or histologic lesions. But there were a few of them, and you certainly can see lower in anything that had to do with the claw or the vesicular lesions, or a little bit in tonsil and inguinal lymph node. Otherwise, the other ones were in these more high CT values. So what we did is that barn, they waited about 30 days, waited for those lesions to resolve, talked with FSIS, got clearance to sell those pigs on a Saturday to a small packing plant. We then had the ability to take 10 of those pigs, move them to another facility, and then try to do some serial sampling. So what we set up to do is we ID'd those animals. We collected serum. We collected a nasal swab. We did tonsil scrapings, and then a swab of the tonsil scrapings and rectal swabs. And then what we did is we followed them here on a weekly standpoint from 36, 43, and 50 days, and reported at averages. I probably could have done this more in positive, negative, but what you can see is virtually everything was serum positive. There was one here out late that was in the mid-30s. The cutoff on this for the CT is 40, and that's probably somewhat arbitrarily set. We haven't gone back and done the serial dilution to really understand where the true cutoff is for that. We're using 40, but you can see, out to this 30 to 50 days, doesn't appear to be very many positives or very low CT values in serum and nasal swabs. Tonsil swabs, we probably had a little bit lower CTs, more positives here early, but starting to progress, and then same for the rectal swabs. By the time you get out here to 50 days, you probably got half of them that are negative, half of them that are positive, but in that mid to upper CTs. So probably the most important thing now is what you get concerned about is, environmental contamination. These are in kind of more of an outdoor feeding floor, so not a traditional finishing barn. So we're going to go back and do virus isolation on these to try to determine, is that virus still viable or not, to kind of help with trying to understand, well, how long should you hold pigs if you think that there's a threat to move them and they may still be shedding. So once again, that was much appreciated to Swine Health Information Center for funding that little study. So we're dealing with a bunch of cases in exhibition pigs and market pigs. And then we hired Dr. Linhares on August 3rd, was his first day. And he starts talking to us because of his Brazilian experience about what we really saw in Brazil was more this neonatal mortality presentation. So he educated us on his second day on the job, and then we started to go back and look a little bit closer and start contacting veterinarians, had a few contact us with kind of high neonatal morbidity and mortality in pigs less than 7 days. So this started a couple weeks after that, usually with diarrhea, but sometimes without. And in some of these cases, they weren't really finding much for PED or E. coli or rotavirus or Clostridium. So the pathologist with that knowledge from Dr. Linhares, we started to look at Seneca Valley virus. They did report, too, on some of these presentations in the farrowing house that some of the sows did have a fairly high fever. Not all of them, some of them. Didn't really appear to go completely off feed, but they just weren't finishing all the feed that they normally would at feeding time. And then in the cases of mortality, like I said, it was really only in neonatal pigs, 1, 2, 3, up to 4-day-old pigs. But that mortality was short-lived, so it affected a room or two, and then things went right back to normal. Very similar to what the Brazilian experience was. So from the descriptions of these, we started to test using our real-time PCR test, and lo and behold, we started finding positives. And in several of the cases, we got calls from the veterinarian and said, well, I got Seneca virus. What does that mean? And the conversation, well, are you seeing anything? Well, the farms aren't reporting anything. So in the couple of cases that I had the opportunity to be involved with, after discussion with the veterinarian, it was like, if I were you, I'd go to that farm tomorrow morning and call me at noon. And in both those cases, the veterinarian went out there and started looking, and sure enough, he found anywhere from about 10 to a 40% prevalence of vesicles and coronary band lesions. Most of them tended to be vesicles on the nose. Sure enough, they could find them, But the pigs or the sows weren't obviously sick or obviously off feed, so you could understand how just walking through, we don't look at a lot of snouts when we, do a farm visit. You could see where they were missed because they weren't obviously lame, and they really weren't all that sick other than their litters. We had some litters that looked really bad, but looked like a bad E. coli or rotavirus or Clostridium. But sure enough, upon further examinations, we could find it. But absolutely no lesions in the young pigs, either grossly or histologically. So we took some of these affected pigs back. We took some clinically affected that were still alive. Didn't matter. We weren't finding vesicles on the nose. We weren't finding anything on the feet. And then when we took the pigs apart, let the pathologist look at them, same story. They couldn't find anything grossly or histologically on them as well. But as we went back through some of those farrowing rooms, we saw lots of lesions on the feet. By the time I got into this farm, they'd actually had been over it for about 10 days. Didn't see much for vesicles on the nose and farrowing, but lots of coronary band lesions on the feet, and I'll show you some pictures here in a second. No lesions in the pigs, but then when we went out to gestation, where it was a little more active and newer, we didn't really see the feet lesions. We saw the vesicular lesions on the nose instead. That was kind of the signalment. So just some pictures here. This is from the farm, a clinically affected litter here, and right next door, completely clinically normal presentation. Just another litter here. You can see there's probably a pig dead there, and there's only 3 pigs left in that litter. That's because the rest of its litter mates had died already. But sitting right next door to a very clinically normal litter. But you can see, I've seen bad rotaviruses, bad E. coli's, PED looks exactly like that. So here's just a ruptured vesicle on the snout of one of the sows in the farrowing crate. Here you got a lot more of these erosive ulcers in the farrowing crates there. We saw a lot kind of on these lateral and intermedial surfaces of the coronary band, some interdigitally, like here. There's a big interdigital ruptured vesicle there in between the toes. on one of those farrowing sows. Here you can actually see kind of a full bullous vesicular lesion here on the snout on this sow. This one here, you got some coronary band edema, and you can see here's a blister that was there, a vesicle that was there and had ruptured, and you can't really appreciate. Here you see some of those deep nail bed hemorrhages right there as well, and one back here on the dew claw. There's another picture of that deep nail bed hemorrhage on a sow. Then here you got some more of these erosive lesions on the around the coronary band of the front feet there as well. So that was the question, and Paul had mentioned this morning is like, well, are we finding virus in just the pigs or whether they're affected or not? So these pigs A1 through A4, this is CTs of Seneca Valley virus or Senecavirus A. These pigs A1 through 4 were more clinically normal pigs. Here you got B1 through 4. They were probably more of the affected litters, and when you look at them from a cycle time, and this is just serum, and I remember in the market pigs, it didn't look like those CT values were very significant, but in these little pigs, they're all in the low to mid-20s, with one even lower than that. There's a lot of virus here. And then we looked at fecal material, some skin, coronary bands. Even though there were no gross lesions there, we just sampled them, and they're all in this low to mid-20s. So these piglets appear to be loaded with a whole lot of virus, but same story, absolutely no distinct histologic lesions on any of these pigs at all. So what's killing them, right? There appears to be full of Senecavirus A, but there's no distinct histologic lesions that would indicate why these pigs are dying. I don't have an answer for that, by the way, but yeah, so don't ask. Yeah, they still had, just like what Dr. Linarius had shared yesterday, some had, not all of them, but majority of them still had milk in their bellies, because that was one of the things. Is this a sow not milking issue, or is it a piglet issue? And, it just depended. This is pulled from 3 different cases. Here was a tissue homogena pool, fecal swabs from a couple of cases, all in these low to mid-20s. So saw some cases reported the gross findings of mesocolonic edema. Actually, one of them that we went back and retrospectively tested, that was what they were complaints were. Hey, I've got all this Clostridium difficile, but it's killing all these pigs. Normally it's like they get scoury, but you treat them and they get better. Well, sure enough, went back, tested them for Senecavirus A, and they were all positive. So I don't think that that's from Senecavirus A, but in those cases they found Clostridium difficile with it. And I don't know if it's a cofactor thing. Did the difficile make the Seneca worse or vice versa? So, sow serial studying. You saw that Paul, Dr. Sundberg had shared that this morning, doing one at Minnesota and Iowa. And we're following both clinically affected and unaffected sows and a pig or two from each of their litters, for a period of time. And we'll do looking at PCRs on serum, rectals, tonsil swabs. Initial plans to kind of follow for 6 weeks, then reassess. And then we'll follow those pigs into the nursery and do oral fluids in the rooms that they're in to see, I'm assuming that they'll all go positive, and then how long do they stay positive for, to try to answer, well, how long are these pigs a risk potentially to shed virus to other pigs if they're moved? So that's the biggest question, is what's the impact been on pre-wean mortality? We say we got about a week's worth before the clinical case is finished. It's variable, but it kind of appears it can be a small. Here's pre-wean mortality from one farm. Here's the week, and you look at their normal week-to-week variation, they're in that 10 to 16%, and that's just at the higher end of normal. Talking to a few practitioners, though, where they did have a Clostridium difficile or another agent, they could see the mortality increase to 1.5 to 2 to doubling their pre-wean mortality, but pretty consistently for that week or so, unless these other agents were causing that to persist much longer. And visiting with multiple practitioners who've had diagnosis, they haven't seen any reports of any reproductive impact on conception rate, farrowing rate, litter size, anything like that. Stillbirths, no reports of abortions, nothing like that. So it really just appears to be this 1 week blip in really young pigs. So kind of where are we at? This is taken from our limb system, and then some personal communication that I had, just trying to get a state. So this was kind of as our limb system as of the end of last week. And and the problem with limbs is when you screen it and say, well, everything that's had a Senecavirus PCR, send it to me. Some of them it's multiple cases, like under research or one farm we've submitted multiple times. So you got to do pivot tables and then kind of weed it out. But we would say probably today we're probably looking at 39 different sites or places that we've found it, diagnosed at least once. No surprise, because we're located in Iowa. We've had more cases in Iowa. Some in Missouri, a couple in Illinois. One of them I'm not sure because they didn't list the state of origin. When we break that out by production type, you can see we're probably looking at roughly half the cases here in the sow farms, and then a little bit scattered between nurseries. Here's we've seen it very prominently here in the show pigs during the show pig season here. A couple in gilts, one truck wash. A couple of them they tested some pigs at a cull market or collection point, and then some of them they didn't submit enough information to drop them into one of these buckets. We did retrospectively go back and then look at more of these neonatal diarrhea cases, and at least on the first screen we can diagnose cases back kind of to that end of July period as well. I think Dr. Sundberg had mentioned Schick sponsored, I should put the Schick logo on here, but they sponsored an oral fluid survey, kind of understanding that from that one finishing case, it looked like the oral fluids were positive at least out to 4 weeks. So in the absence of an antibody test, it would at least give us some idea of where the virus was. Both Minnesota and Iowa went back that last week in August, and we took every oral fluid sample that came in for no matter what it was sent in for, and tested them all. And what we found was really a pretty low incidence. We just found 2 cases and sites that had the origin from Illinois, 1 from Iowa, 2 from Indiana. So when you do the math on all that, very, very low prevalence. It was only 1% of the oral fluid cases that were submitted that week, and roughly only 0.5% of the samples that were tested positive. So I think Dr. Sundberg described it well this morning. It's national in scope, but we're still looking at fairly low prevalence of where we're seeing it. So we had the ability, and I know Dr. Vanucci shared their dendrogram yesterday, and they've been good collaborating partners, working back and forth with them. Looking at a dendrogram, I'm going to just show you part of it. This is just based on the VP1 region, and what you can see here, here's all the historical isolates. Like we say, it was first found as a cell line contaminant. So that was back in the 80s. So these here, you can look at the dates. You got 2001, 1997, 92, 89. These are more of the historic isolates, but you can see they kind of all clump together. But now what you're seeing is all these newer cases here. These are all the ones that we had here into Iowa. They cluster pretty closely together. And here we had the opportunity to get the sequences from a couple of the Brazilian isolates in a little bit different clade than what we're seeing here, but more closely related than the historical as well. And then the Canadian isolate from the case in 2011 and a feral pig isolate from 2001, which is a little bit further out. This is the VP1 region. So that's probably a little bit more variable, but when you do this and look at the whole genome sequencing, the dendrogram looks the same. It's just the percentages are a little bit different. So it's really to say it looks like the virus may have potentially changed, and maybe that's why we're seeing an increase in incidence of it. And you kind of look down here at the bottom, if we compare the contemporary strains, just comparing VP1, we're in that 99 to 100% range compared to the Canadian isolates. We're at 95% VP1, so obviously on the whole genome sequence, these numbers are higher than what are being reported here. Compared to the Brazilian isolates, in that 96 to 97% range, and about 85 to 93% on these more older historic isolates. So probably the biggest take-home message I want to leave you with as you work with your producers or work with your veterinarians is just to get this word out. We got to get this word to the slat level people, and just like what Dr. Sundberg had mentioned this morning, what do we do if we suspect lesions on the nose and or coronary bands, right? And I think the biggest thing, and Paul outlined it well, contact your veterinarian. They'll contact the state, federal officials, stop movement. Those people will direct you on what the next best steps will be, and generally the turnaround time in our experiences with the Plum Island tests have been fairly quick and fairly rapid, so it's not like we're waiting a week or two to get the results back. It's usually within 24 to 48 hours in most cases. And they'll really kind of determine the next course of action. As Paul mentioned, don't attempt to sell the pigs with active lesions. Wait until they're completely resolved and then communicate with your packer and the FSIS there. If you see an increase in that pre-wean mortality in young pigs, and a lot of times you'll get Clostridium type diarrheas, but they're usually responsive. These cases in those couple of rooms that get affected, they're fairly unresponsive, so that ought to be a signalment. The biggest thing is to make sure you're talking to your veterinarian about there and start looking for these vesicular lesions, and if you see them, then contact your state and federal officials. So really, in summary, that looks like we've seen a significant increase in the number of cases of idiopathic vesicular disease. We're saying it's Senecavirus A. We don't absolutely know that for sure, but a high association. Also seeing cases of increased pre-wean mortality over a short duration in pigs less than 7 days. The clinical pictures really match and mirror what happened in Brazil. They saw their first case this time a year ago, and the unnerving part is it moved across that country in a very rapid time frame. And it looks like the virus may have changed from the historical isolates, and then biggest thing is we just need to continue to be diligent and vigilant to work up these cases as foreign animal diseases. What we don't want to have happen is people just get so used to seeing it, and then we have foot and mouth disease, and before we know it, it's spread all over, and we've got absolutely no opportunity to contain it.